This is actually the area I'm going to talk about. That's the overlap between culture, actually arts and health, kultur og sundhed, which is poorly defined. That's a huge challenge. In Danish, this is a very famous way to put it. Ej blot til lyst, which is from the Royal Theatre in Copenhagen, and it's, you know, all the sentence. Actually, it's a one-liner. The next line is not given, but ej blot til lyst, men også til sundhed. Also for your health, you should go to the theater also to get healthy. So I mean, it's well known, but it's a curious thing about health, because in Danish you think that doctors make you healthy, which is not correct. Doctors treat illnesses and they make diagnoses, but they don't treat you and your health. And doctors also have these patients which feel very unhealthy, in Danish in hypochonder. Doctors say you're okay, but they feel very bad. And it's even written a book here for these guys, and it's very popular. You can see it's 10 times 100,000. It's 1 million people who have studied this in detail, how to feel unhealthy even though the doctor says you're healthy. So it's a curious topic, at least in Danish. This guy is not, as a doctor would say, it is not healthy, but he looks very healthy. You see his leg is off, but I would say he's healthy. So I mean, disease and fighting disease is not equal to being healthy. It's more complex. So me as a doctor, and I'm the worst kind of doctor you can imagine. I'm an anesthesiologist and intensivist. I'm the guy who, you know, drives these ambulances and fly the helicopters and make cardiac transplants. So blood all over the place, life and death all the time, and a very, very bad environment for human beings, patients, relatives, and doctors. So how can we kind of consider this talking about health? This is a doctor, a famous Danish doctor also, Professor Bente Klarlund. And I really like this sandheden om sundhed, the truth about health. That's good. Then we read this and then we know all about it. It's the usual stuff, you know, what you eat, don't smoke, don't drink too much, and remember to exercise. I mean, it's well known by everybody. What I really liked about this is if you live like this, you're getting 14 years younger. That was really intriguing for me, because who wouldn't like to be 14 years younger? She actually meant you're living another 14 years. So if you get maybe 100 years, that's not as interesting, to me at least. But so health is very complex. So talking about this environment and talking about health, it's very complex. It's about friends and how your own feelings are, what you eat and what you do for a living, and so on, is very complex. And I cannot kind of make the whole speech about that. Just pointing out that mental health issues is an increasing problem. In 2021, it's every 6 Dane who have a bad mental thriving, dårlig mental trivsel. You can ask questions about this number, but it's every 5th of you, every 5th of us. So it's every 5th of our patients at the hospital. How are we taking care of these vulnerable people? And we also have this in Denmark, probably also abroad, that the social status actually plays a role in disease and surviving. You have this famous investigation in Aalborg, 10 years difference in lifespan if you live in Western Aalborg versus Eastern Aalborg. That's the difference, 10 years. Knowledge is growing. This is RCT, Controlled Studies Concerning Music Intervention. You see it's growing huge this year. From 2000, it's just expanding. And so we have a lot of knowledge. In Denmark, sparse knowledge. I've actually contributed this book, Kultur og Sundhed, so you can read about it. In Northern Jutland, we have this organization, Nordjysk Kultur og Sundhed Center. It's a center for cultures and art. So we're quite well off in North Jutland. I've been working in US. Dare not to say it at the moment. But I have done that for some time. And hospitals over there, this is not a museum, or these are private hospitals, but their goals are not the same as Danish healthcare. They actually try to make the patient feel comfortable and stay at the hospital because they pay every day they stay there. So the better environment, the more cozy and the better food, the longer they stay. So it's a matter of earning money. And they even send musicians into the ward so they can play the harp to make patients feel better. I would be very scared if I was lying in a bed and somebody play the harp for me. We would never choose that here in Denmark. What about Aalborg? And now I'm almost coming to the core of it. This is a new hospital very close by here. It's overspent money, vast overspent, and they cut all arts, all discussion about arts at this hospital, just white walls and nothing else. That's too bad. This is inside the hospital. The green area looks like this, not reserved any money for this, which probably is going to be the place where you go if you have a disease. So it's a problem for you. It's not just a problem for the hospital and the community. It's the economist, and they have still not reserved any money. You can't read this, but they actually neglected it because it was so expensive to build, and they had not reserved any money because they didn't find it important enough. I've tried to do something about this, so we have made this catalog. I've been working for this for a year, and I'm quite confident now that we will have arts in the, when the entrances and the hallways and so on. We'll have fine arts. No, not from public money, but from private donations. And this is who is giving the advice. Also, a local Gitte Ørskov, quite famous actually in Scandinavia, head of Moderna Museet in Stockholm. But what about the ward? This is the place where pregnant women having a stillbirth, the kid was dead or could not live. This was where she used to be placed. And she could lie there until she had her dead baby together with her husband. We tried to rebuild this in order to make a kind of, shouldn't we do this differently at the new hospital? So the same room was changed to this. It's the same room as you saw. New furniture. All the stuff is hidden behind that white screen. And up here you have nature, actually, films of nature, various kinds of that. So this is probably going to be the new standard for at least our hospital. And we tried then to make this be at least 10% of the wards. We don't know whether we can get the money, but you see the components are not really expensive. But this is the big question, and not least after tonight, I think it's the products shown here differs very much because you all have different preferences. I think that AI or nature or whatever would be a very important part of this. It could just be a color. And actually the most popular thing having on the wall is this, white clouds and blue sky, drifting slowly. So, I mean, this frame setting, this is a kind of mock-up, but this is really the kind of thing you may expect when you come to the new hospitals. We make 3 of these or similar rooms out there to make this framework being art, individual, and a bit like being home. So we try now to make a different setting around the patient, and we'll have to have you, Kit. You are very intelligent and clever people down there. Help us concerning content. I've shown this. This is a famous Danish actor who helped us actually, because we had to teach our staff to treat patients in these surroundings. They were actually not used to being nurses in a room, which was nice. So they were just nurses. Now they had to be people, human people. So I think it's a very interesting development, and we can change a lot. And we have a furniture industry in Denmark. This is quite traditional, but maybe new furniture is taking care of all the bacteria and the problems we have specifically at hospitals. So I hope that this item can thrive as an experiment in North Jutland, and I'm happy to announce that there has been established a foundation here in Aalborg only to support this at Aalborg University Hospital. It's one of our lawyers here, Anders Hjulmand, who's quite famous, and he's heading this organization. And hopefully, because we are copying a Copenhagen foundation, only two foundations in Denmark, ours and another one, and this is the one related to Rigshospitalet. And they managed within 4 years to get 600 million Danish crowns. That's a huge amount of money. So even if we only can have a fraction of that amount, I'm sure that it's make really a difference, because we have the advantage that we are starting from scratch. We have a lot of people being positive about this. We have a lot of researchers. We have the university engaged in how to do this in the right way. And this foundation will support us, not this one, but the local one will support us in the long run. So it's not just a question of, saying now it's open, this new hospital, and then we stop all development and innovation and research. We are planning to research for many, many years in this topic. So I really hope that in our theaters in Aalborg, we can add to Ej blot til lyst, at the music house and kulturen, men også til sundhed. Not just for amusement, but also for your health. That would be a local Aalborg team. I think it will be very nice. So I'm finishing now. Thank you for listening, and maybe you have some questions afterwards. Thank you.